So you're thinking about being a dentist in the Philippines, and you're kind of lost right now. Well, this video will tell you the basic things and considerations you should know before committing yourself to the heavy load of a deal of choosing dentistry as your course in the Philippines. Take everything with a grain of salt, and you should be fine. 1. It is a 6-year course. Yep, you heard it right. It requires you 6 years to be a dentist. 2 years will be allocated as pre-dent years, where you will be studying general subjects and introductory courses about dentistry, and 4 years should be for the dent proper. 2. You'll be a doctor after passing the DLE. Once you graduate and pass the dentistry licensure examination, then you've accomplished adding DMD in your name. People can already call you with doctor as standing for you being a licensed dentist. Good one, right? 3. It is an expensive course, as most state universities do not offer such a course. You'll have to consider the tuition fees and other miscellaneous fees in private college or universities. And for the most part, dent medicine requires quite a more expensive school fees. Other than that, you'll need to consider that as you go on to the higher level, you'll need to have more and more tools and equipment associated in the practice. 4. It is heavy on memorization, symmetry, and precision. If you are someone who's quite interested in science and art, well, dentistry is the intersection of both. It would require you to specialize in a body part as well as make considerable treatment and preventions within a very confined space, the mouth. Every millimeter of the tooth counts, and should you copy the other tooth, you'll need to be precise in your measurements and have a keen eye on details. If it so happen that you see yourself as someone who's not so gifted in arts, well, worrying not, as it is a skill you can improve on through the years of practice within the dental school. 5. It is an arduous course on its own. Many would compare dentistry and medicine, but they are different from one another. They have both their own identities and significance in our society. As for dentistry, you should also know that it's quite a challenging course. Not only do you need dexterity, you'll first engage in a whole lot of information to familiarize yourself with before actually stepping into clinical years, where you'll finally be handling patients. So yes, the first 4 years, you'll have to go by the books, study a variety of materials, and enhance your hand skills before you can get into the last 2 years, where you'll finally practice the actual skill aligned with dentistry. It can definitely get lonely from time to time, but every level is a must for the future you are building for yourself. While choosing a course can be quite challenging, you'll have to remember that the decision entails a careful consideration of your situation, your plans and principles, even your environment. Dentistry is a good course, but it entails specificities that can or cannot be fitting in the future you are trying to build for yourself. But yes, the decision is yours. Dentistry may or may not be for you, and that's fine anyhow. That's all for today's video. I hope this introduction to dentistry allowed you to realize some basic and valuable information about the course. Thank you, and don't forget to subscribe if I helped you in some way or form. See you on the next